Constipation treatments. You have a lot of options for treating constipation. What you choose will depend on why you are blocked and whether it's a new or long-term problem for you. Constipation home remedies. You may be able to solve your constipation problem yourself without your doctor's help. It may seem obvious, but your diet has a big impact on how you poop. Eat more fiber. Fiber makes stool bulkier and softer, so it's easier to pass. Gradually increase the amount of fiber in your diet until you are getting at least 20 to 35 grams of fiber daily. Good sources include all grains found in cereals, breads, and brown rice, beans, vegetables, and fresh or dried fruits. Prunes and bran cereal are tried and true constipation remedies. Stay hydrated. Water is important for preventing constipation too. Try to drink at least 8 glasses of water a day. Try coffee. While caffeinated drinks can make you dehydrated, there is evidence a cup of coffee or tea in the morning may help you poop. Limit high-fat or low-fiber food. Cheese and other dairy products, processed foods, and meat can make constipation worse. Watch your food maps. Certain carbohydrates cause digestive problems, including constipation in some people. The names of the carbohydrates are abbreviated FODMAPs food maps. Foods that contain them include dairy, apples, broccoli, wheat, and lentils. You might try cutting individual foods from your diet, but do it carefully. A lot of them are good sources of fiber and other nutrients you need. Other things you can do to relieve constipation include exercise regularly. Moving your body will keep your bowel moving too. Adjust your toilet posture. It may be easier to poop if you squat, raise your legs, or lean back. Check your meds. Many prescription drugs can cause constipation. Ask your doctor if this might be the problem and if there is an alternative. Biofeedback. Some people get constipated because they unconsciously clench their muscle when they try to poop. A therapist can help to train your pelvic floor muscle to relax. Massage. Massaging your own abdomen in a certain pattern can help encourage bowel movements. Enemas. You can irrigate your colon with either tap water or an over-the-counter preparation to soften and flush out the contents. Suppositories. Some over-the-counter constipation medications are meant to be inserted directly into the rectum. They typically work faster than laxatives you take by mouth. Prebiotics and probiotics. You may have digestive issues including constipation because of an imbalance in the bacteria that live naturally in your intestines. Supplements or food containing prebiotics like bananas and oatmeal and probiotics like yogurt and fermented foods may help. Laxatives for constipation treatment. A box of laxatives shouldn't be the first place you turn to relieve constipation. Reserve laxatives for constipation that doesn't improve after you added fiber and water to your diet. If your doctor recommends laxatives, ask what type is best for you and for how long you should take them. Laxatives are best taken short-term only because you don't want to start relying on them to go to the bathroom. Also, ask how to ease off laxatives when you no longer need them. Stopping them too abruptly can affect your colon's ability to contract. If over-the-counter treatments don't do the job, your doctor may prescribe a different kind of medication. Prescription laxatives such as linaclotide, leucopristone, antiplakentide, serotonin 5-hydroxytryptamine 4 receptors, Pamuraz. This is a shorter way of saying preferably acting mu opioid receptor antagonists. This work on constipation that's caused by opioid pain medicines. Surgery for constipation treatment. Sometimes constipation is caused by a structural problem in your colon or rectum. Your colon may be blocked or usually narrow, or you may have a parietal collapse or a bulge in the wall of your rectum. In that case, surgery can correct the problem. Surgery may also be the last resort if your colon just works too slowly and treatments haven't helped it. You may need to have section of your colon removed. When constipation is a regular problem, regardless of what constipation treatment you see, give yourself enough time to sit on the toilet when you need to go. Holding in the urge can make your constipation worse. Set aside a regular time for the day when you know you will be left undisturbed for several minutes. Also, don't ignore the problem. Untreated constipation can lead to real problems, such as hemorrhoids and the trees in the skin around the anus, called fissures, that make you bleed. If you strain too hard, you might even cause part of your intestine to push out through the anus, a condition called rectal prolapse that can sometimes require surgery. Call your doctor right away if you have any of these symptoms with constipation. Stomach pain, blood in your stool, unexplained weight loss, inability to have bowel movement. Also call if you have been having trouble going for more than 3 weeks and the constipation treatments aren't working. You may have a condition called chronic idiopathic constipation, which means your constipation may be caused by something other than physical. Constipation treatments. You have a lot of options for treating constipation. What you choose will depend on why you are blocked and whether it's a new or long-term problem for you. Constipation home remedies. You may be able to solve your constipation problem yourself without your doctor's help. It may seem obvious, but your diet has a big impact on how you poop. Eat more fiber. Fiber makes stool bulkier and softer, so it's easier to pass. Gradually increase the amount of fiber in your diet until you are getting at least 20 to 35 grams of fiber daily. Good sources include all grains found in cereals, breads, and brown rice, beans, vegetables, and fresh or dried fruits. Prunes and